In most instances, the seller has no responsibility for financing part of the purchase price. I can think of one case in the past 15 years where we've had a seller carry back. In the vast majority of the cases, if you find the right buyer and you have a practice that is properly valued and doesn't have any unusual circumstances, typically part of our job is to secure 100% financing, and oftentimes anywhere from 90 to 100% financing from an external source for the real estate as well.
And I'd like to add that it's usually a bad deal for a seller when they have to carry back financing because they no longer have control of what happens to the practice. And they don't have collateral to the practices. When the loans, the banks come in, they'll have liens on the equipment and any hard assets. So it's not something that we recommend that the seller carries back any of the financing.
Now we are seeing that practices, if it's the right practice or the right buyer, can definitely receive 100% financing. On real estate, generally, it's only 80% financing. And so the choices are on real estate, if it really cash flows, then at that point they may offer the purchaser additional working capital that can be used toward that 20% gap. If not, then there will be seller financing expected.
Funding for transitions is changing. The landscape is changing. For initially, all sellers had to do owner financing, and then as we moved through some of the 90s and early 2000, we could get 100% financing plus working capital. Now that is changing a little bit more, and as sellers are stretching the limits on what they're asking for the practices, some of the lenders are backing off, and you most probably have to fund 10 to 20% of your transition if you're at the top end of what the market allows for the transition price.
Here at California Practice Sales, we not only take the care and time to work with the seller to gather all the information that the buyer is going to need to get their funding, we also assign a broker to assist the buyer to do that as well. So we have both halves of the puzzle, we put them together, and we will shop the funding source that best fits your situation.
Our hope is that you will have two responsibilities. One would be to provide us the information that we need to market and successfully transition the practice for you. And number two, to engage the buyer in a showing setting. In other words, showing them the practice, talking to him a little bit about your relationship with your patients and your relationships with your staff. After that, we pretty much do all the heavy lifting.
Well, I think the biggest responsibility of the seller in financing is to be able to provide clean and accurate financial information about the practice over the last several years. In today's market, we're generally able to get full financing at closing for the buyer to give to the seller. So there's not usually financial demands on the seller to close the deal. But certainly there's an expectation, and frankly there'll be due diligence done to make sure that the information about your practice is correct and accurate, and that's what they're relying on then to make their decision about purchasing your practice.
Normally I would say that the seller in the practice part of the lending doesn't have any responsibility as long as your buyer has good credit. Their cash flow in the practice for them, there should be 100% financing with the lender. As far as with the building, a lot of times a seller ends up having financing for that 15 to 20% that the lender doesn't cover. So normally lender will finance somewhere to 80% on the building, and the rest is usually seller financed.
Generally speaking, the seller doesn't usually have to participate in the seller financing. Normally there's 100% financing for almost any practice we do. There are some exceptions to that, as far as if the cash flow doesn't warrant the purchase price, or and sometimes in certain partnerships, it's hard to get a clean lien on the practice assets. So sometimes there has to be seller financing in certain types of partnerships.